Good afternoon. I'm Rick Christie, Executive Editor of the Palm Beach Post, and thanks for joining us again today to talk about the COVID-19 vaccine distribution. Questions like, where can I get the COVID vaccine? Why is Publix the only option in Palm Beach County? When will more vaccine become available? I have type 1 diabetes, so why am I not eligible? Weeks into this arguably botched vaccine distribution in Palm Beach County and throughout Florida, there are still few issues that dominate the news cycle. More than this, the issue has been especially pointed in Palm Beach County, home to tens of thousands of eligible seniors over the age of 65. The rollout of the vaccine in our county, due to the problems on basically on the federal, state, and even local level, has frustrated county officials. It has raised the ire of anxious seniors from Boca Raton to Belle Glade to Jupiter, and it has raised numerous questions. Today, we're again addressing these COVID vaccine distribution issues with veteran Post staff reporter Jane Musgrave and Palm Beach County Commissioner Melissa McKinlay, who I believe represents District 5 or 6. Let me get this right. 6. Thank you very much. And whose district, which is pretty broad, also includes the Glades region. Now, let me remind those folks who are watching that this is meant to be participatory. So we want to hear your questions and hopefully get them answered. Just leave it in the comments section there on the Facebook Live. And again, thanks for being here. So it's been a pretty busy and exciting and frustrating few weeks here, James. So let me start with you, and we'll hit some basic stuff again. How would you describe the state of the pandemic in Palm Beach County, and why do you think that is at this point?
The numbers are staying in the 5 digits, which is way higher than they used to normally. But the hospitalizations are going down significantly. They have gone down in the last couple of weeks, and that's always a good sign. And I've heard that also, people visiting emergency departments expressing, concern about COVID-like symptoms is going down as well. Deaths are going up. Have been up compared to earlier this month, but those figures are, those people probably died weeks, if not more than a month ago.
Okay, and so, with regard to vaccine distribution, what can you tell us about the latest on that?
Well, I guess, the state of Florida is going to get about 40,000 more this week than they did in the previous week. So that's good. Palm Beach County, which had been last week was going to be pretty much reliant solely on Publix, is getting 5,000 more vaccines or thereabouts. Which will allow more people on the county's waiting list to be served, and also for the county to open a vaccination center in the Glades, which is really good news because there was no Publix there, so there was no place for people in that vast rural area to get vaccines.
Okay, and so the county did not have enough vaccine doses to inoculate. Still doesn't yet have enough vaccine to inoculate those in the sort of the first wave here. And we're talking about frontline healthcare workers primarily, and those over the age of 65 to this point.
Correct. Yeah. They're nowhere near that level. What Governor DeSantis said this morning is about 30% of seniors have been vaccinated in the state. So it's got a long way to go. There's 4.5 million seniors statewide, and about 400,000 of them are in Palm Beach County.
Okay. And Commissioner, let me ask you, and thanks again for being with us this afternoon. Really appreciate you taking the time. And I don't know if you know this particular number or not, but so I'm sorry if I missed it. Jane just said it, but how many vaccines? And I know the county does not run the health department, which is kind of a misnomer that people need to understand. It's actually run by the state of Florida. But how many vaccines the State Department has given out thus far in Palm Beach County?
Actually, Rick, I've got the numbers right here in front of
me. Fantastic.
We've got about 138,000 folks that have gotten the first round of vaccines. and just over 19,000 have completed the vaccine series. So a total of just shy of 158,000.
Okay, doses have been out there, and since this has been a topic here for the past week. Do you break down how many out in the Glades area, which is an area that you care greatly about? I know.
You know, Rick, at our meeting last week, we asked the local director of the Florida Department of Health, Dr. Alonso, if she had broken that data down by zip code. And she said she was working on that, but we don't have the data by zip code.
Here's a question that we keep getting to. If you were to somehow explain what do you think went wrong in the Glades, in terms of distribution, and then maybe what went right? But can you talk about that a little bit for us?
Well, I'm going to start off with what's going right. What's going right is we had a very small operation headed by the healthcare district at Lakeside Hospital. We were finally starting to generate interest in the community and getting people to feel secure enough to go and get a vaccine. What went wrong is we had the governor issue his decision that Palm Beach County was going to run a pilot project only utilizing Publix. So what that would have done is take that operation happening in Belle Glade out of operation. If you're allocating 100% of the vaccines to go to Publix, then the operation we had in Belle Glade was going to close. And that's where our concern was.
Oh, okay. And was the Publix pilot program a bad idea, or just poorly executed?
Well, I guess I should probably finish answering your first question. What went wrong is sort of a lack of understanding on the part of state officials when recognizing Palm Beach County's geography. To make a decision that completely eliminates such a large geographical area of our county just shows that people don't understand that there's two sides to Palm Beach County. Was involving Publix the right decision or the wrong decision? I think it absolutely was the right. Part of using Publix was the right decision. I mean, you're expanding opportunities for people to access the vaccines. Utilizing them solely, that's where I had an issue.
Okay. All right. Thanks. Let me talk a little bit about eligibility here. And Jane, let's help you get us started on that. So again, who is eligible for the vaccine right now?
Those 65 and older, nursing home residents of long-term care facilities and the staff, frontline healthcare workers. And then there was this category that hadn't been served very much at all, was under 65 that had serious health problems. And today the governor announced that about 30,000 vaccines are going to be sent to hospitals to address those people. There was like Baptist Health told me that they were doing like people in their cancer wards and things like that. But this would be a more broad-based opportunity for people under the age of 65 that have serious health problems. And part of the vaccine, according to the Department of Health, some of those vaccines will go to Jupiter Medical Center.
Okay. And the issue of people coming from out of the state or the county to get a shot here, has that been clarified yet in terms of people being able to come here and get a vaccine shot?
Well, the state surgeon general issued an order that said you had to provide proof of residency, I think in an effort to eliminate that problem. There's no county by county restriction that I'm familiar with, but the Surgeon General did say you had to show that you were a Florida resident.
Okay. And that's where I'm sorry, Jane, did I interrupt you or?
No, I was going to say though, snowbirds are allowed. If they can provide like their mortgage documents, their rental agreements, utility bills, they're included. I think what it was, the theory is they were trying to prevent, vaccine tourism.
Oh, right.
They just randomly fly here, get a vaccine and leave.
Oh, okay. And let me clear up something here too, that when we report, the Post reports that 1.7 million vaccinations have been given. What does that mean exactly? 1.7 million vaccinations have been given. That's not the same as saying, because a lot of people have been writing in to me saying 1.7 million people have been vaccinated. Jan, I'm sorry.
Yeah, right. I mean, we usually try and break it down by people who have had the first dose and then another blah, blah, blah have gotten the second dose. I mean, I think, that's what Commissioner McKinlay just said. In
Right.
County, 138,000 people have gotten the first dose, and an additional roughly 19,000 have gotten, are fully vaccinated.
Oh, okay. And okay, hold on a second here. I'm trying to see about folks who are streaming in with questions, but I can't see the questions for some reason. So hopefully we'll get that little technical glitch cleared up here. Hold on. There we go. Sorry, that was I'm the technical glitch. So there we go. Let me see. Oh boy. Just some comments again that I'm sure you guys have heard these already, and maybe just to kind of give these people a little bit of comfort. My 88-year-old father has been trying to get an appointment for a vaccine online for weeks. Still no appointment. This is from Karen Deaver Wright. Commissioner, and I'm sure you've gotten some of these questions from your constituents. What do you tell them when you get this kind of a question?
I tell them I understand their frustration. I mean, my father doesn't live in Palm Beach County, but he lives in Florida, and he certainly qualifies. He can't get a vaccine either over in his county in Sarasota. We're dealing with a federal supply shortage in terms of the number of vaccines that are coming into Florida. But we're also dealing with a county where the only way you can register for a vaccine right now is through Publix. And those are our options. That was decided on by the governor. Those orders are being carried out at the local level by the director of the Florida Department of Health here in Palm Beach, Dr. Alonso. There should be a state registry for you to be able to at least go in and add your name to a wait list. Dr. Alonso has decided that that's not an option for Palm Beach County residents. I oppose that decision. I feel like people would be comfortable knowing their name was at least somewhere and that they would be expecting a phone call at some point. Hopefully she'll reverse the decision, but she doesn't work for us. She works for the state. So those are her decisions that she's making. It's very frustrating for everybody. And I wish I had a magic wand and could get 1 million vaccines delivered here tomorrow to vaccinate everybody. But we're dependent on the governor and we're dependent on the federal government.
Okay, and so let me ask Jane here something real quick before. So Jane, you were saying people have already started getting the second dose, and one of the questions we had too was if this from a person who said, "Well, I got I got my first shot, and got an appointment, and everything. Are they still good to go as far as with the healthcare district or the health department to get their second shot, or do they need to call and make sure they still have that appointment?"
So far, we have heard no reports of people not being able to get the second shot. I know there's enormous anxiety out there among people that have gotten the first shot and then they haven't heard anything. What Dr. Alonso told me is that within a week of their second shot, people will receive a phone call. So I talked to somebody today who's pretty convinced that, they messed up. He had an unusual email address, so he never got an email confirmation yet. His wife did. But, what I told him is that, a week before, if you haven't gotten a call that your second vaccination is scheduled, then I think you should get worried. But up to that time, I just think that, you just got to relax and just have faith in the system will work at that level. I mean, I know the system hasn't given you a lot of reason to have confidence at this point, but nowhere I've heard have second doses been an issue.
Okay, good to hear. Commissioner, back to you. I wanted to ask you about something because I think you mentioned something about not availability, but supply of vaccines. And I believe the Biden White House or their CDC task force is recommending just if you're a state like Florida and we have given you all of these vaccines, individual shots, that you just go ahead and just get the shots in the arms of people, and worry later about, about when they can get the second dose and whether or not we'll get the vaccine to you for a second dose. Do you agree with that? And first of all, and if so, or if not, why or why not?
Well, that's a difficult question, Rick. I mean, if you just be based on the previous question you just asked Jane, will those second doses be available? We need to be able to assure people that yes, those second doses will be available. That's a tough one.
Yeah.
I say get as many shots in as many arms as possible, but we do need to make sure that we've got those second rounds available. I mean, 28 days comes faster than you can imagine. Recommended is actually 21 days to 6 weeks. So we need to be very careful in making sure we have assurances from the federal government that those second doses are going to come.
So it would be just if we did go that route and just started just getting as many vaccines in the arms as possible, it would be basically another level of faith that people would have to go to.
And based on the operation so far, I don't know if I'm willing to support taking that leap of faith right now.
Yeah. Okay. So, Jane, can you tell us whether have we heard anything else? Have you heard anything else about teachers and whether or not whether debate is going on that? Because I know teachers around the state of Florida have been really pushing to be like next in line, and this comes, as you can tell, from Sarah Bond McLennan. Have you heard anything else about that discussion or that debate?
Governor DeSantis has been kind of not real clear about who would be in the next wave once all the seniors have been vaccinated. He's mentioned law enforcement. He has mentioned teachers, but there's nothing official about, who would be next. And he just mentions kind of in general, working people.
Yeah. I have people asking why, and I think this is Sarah again, asking why just Publix? What happened to Walgreens and CVS? Can you explain that to her, Jane? What happened to those two and what they were being used? Because I believe they were already involved.
Yeah. Walgreens and CVS had got a federal contract to do all the nursing homes, residents and staff. I know I did hear that the federal government was going to ask Walgreens and other retailers, even Walmart possibly, if they were interested, and I haven't heard anything about that since. So I mean, why Publix was selected, I don't know. I mean, that's not clear.
Yeah.
Except they are huge. They're huge in the state. I think they have something like over 700 stores.
Well,
probably the grocery chain.
Something like that. I think closer to 800 actually, but I think these people are just wondering why not pull in somebody else. But I think a lot of people forgot that, as you just said, that CVS and Walgreens actually have federal contracts that got them into the nursing homes to get those people, I believe, to get those people vaccinated. Hold on.
Rick, do you mind if I add
something? Go ahead, please.
That real quick.
Sure.
We're the only county in the state of Florida that has that Publix only partnership. So in other counties that have the Publix partnership, they also have other sites that are distributing it. So I think we're a little bit different. But on the teacher thing, it's a little frustrating, at least for teachers that are 65 and older. We should be setting up single points of distribution for those teachers that are 65 and older. Other counties have done that. Lee County has done it. I believe Leon County has done that. It's about 7 or 8. Dr. Alonso has a strict interpretation of the governor's order that says she can't delineate certain sectors of the 65 and older population. But I feel like if we've set a precedent in other counties across the state, we should at least be able to do that right now, tomorrow, this weekend for our teachers that are 65 and older.
Yeah, I was going to ask you, since you kind of went there with it a little bit about the other counties, because I know you're also president of the Florida Association of Counties, and ask what you were hearing from some of your colleagues in other places about what they're seeing, and maybe how they're dealing with it.
Yeah, well, we're not alone. The county system certainly is not alone in its frustration, whether it's a rural county, a small county, or the urban counties. All across the board, there's frustration. Our leadership will be doing a call this week with Jared Moskowitz, the director of emergency management, so we can sort of voice some of those concerns. But I think local government feels a little bit out of the loop here, since so many of these decisions and control is handled through the governor's office and the Florida Department of Health. And so our frustration is we are ready to roll out these emergency operation plans that we have. We've got the logistics, we're set up to go, but we're kind of the last ones to know what's going on. And a lot of the frustration from counties across the state comes from that.
Oh, well, I'm sure I've got a few people on here who will be glad to hear that, if you guys are somehow able to do that, who are saying we need more places available now and everything. So there are some people who are kind of waiting for that to happen, at least here in Palm Beach County. Let's see. What do we need to do to make sure that those communities not served by like a physical Publix pharmacy can get an appointment for a shot? Commissioner, what do you think?
We need to bring the vaccine to those communities. We're doing a site out in Belle Glade at the State College on Friday for folks out in the Glades, but we need a mobile unit. We need to be driving into communities and doing pop-up vaccination sites, very similar to how we did the testing. We're seeing this movement from testing into vaccinations. There's no reason we can't bring the vaccines to the neighborhoods that aren't served by the Publix.
Okay. I mean, wow, okay. Do we have, so we already have like, I don't know, special vans or something, or you're not talking about they don't have to be specially equipped or anything?
Yeah, they do actually. They have to have a refrigeration system in
right,
and be able to operate computers to do the registrations. But we purchased 2 mobile units for the healthcare district with the county's CARES Act dollars that were used for testing. One of those is being used as a mobile unit right now for vaccinating. Of course, they're all run by the healthcare district. The other one's still being used for testing, but as we start to receive more vaccines, our hope is to roll that second unit into vaccines as well.
Okay. Have a qualifying. Preston Paget is asking, what about those that are under 65? Okay, and this goes to so Jane, I guess they may have missed what you were talking about earlier regarding the folks under 65, but have a qualifying health condition. Can you explain that again, please, for those folks who may have missed it earlier?
Yeah, the Governor DeSantis said just this morning that they were going to release about 30,000 vaccines statewide to hospitals to help them. In Palm Beach County, what I understand is that Jupiter Medical Center is getting them. And I have not heard back from Jupiter Medical Center as yet of, what their distribution plan to the community will be. But I mean, I guess that there is some good news that there is at least one place that, that's where you're supposed to go to get the vaccines. I don't know why Jupiter was selected, but that's what I understand. And I don't know whether additional hospitals in the county are also, no other ones were on the initial list that was released by the health department today.
Right. And so we would also have to kind of wait until we hear from Jupiter Medical about how they're going to make those vaccines available as well, because I mean, not everybody's going to be driving up to Jupiter who has comorbidities, correct?
Correct.
Okay.
I mean, I don't know. So I think some people are desperate enough they would drive that far, even if they have a boat of a name in town. And DeSantis explained that this is what he said this morning, is that he didn't want like people at vaccination sites to be in the position of saying, no, you're not sick enough to get it. Oh, you are, you're not, you are. So that's why his justification is why those under 65-year-olds with comorbidities had to go to the hospital because then a doctor could make that call.
Sure. But again, if you're all the way down in Boca or Delray or South Bay, I mean, Jupiter Medical is a pretty big hike. Okay. All right. So maybe more will be coming out from them as to how they're going to get that out to those out to those people. But at this point, so in our county, let me be clear here. You mentioned two, Jane. I think at the very top you mentioned there are two entities here: the healthcare district, which is taxpayer funded from I believe Palm Beach County property taxes, and then you have the health department, which is run by the state of Florida. So when I ask who is responsible for setting up where you can get a shot, would it be both?
To some extent, yeah. The health department, where everybody originally registered with the clunky email address.
Right.
Now the healthcare district is scheduling those people for appointments. So, I mean, it does, I think they're both working on that list. And I mean, it is confusing for people because they registered at one place and now another place is actually administering the shots. And then they have to go back to the first place they went, like the health department, if that's where they got the first shot, or the healthcare district. And unfortunately, they both have very similar names, which just adds to the confusion.
Yeah, let me add to that.
Please.
Try to paint a picture. The federal government sends the vaccines to the state. The state sends the vaccines to the local health departments. The local health departments are run by the state, but they're allocating it to partner agencies in the county. In our county, their partner agency, of course, is the healthcare district. They have, as we've read, allocated some of those to cities that have their own fire departments, but those allocations were small. You also had the federal government sending direct allocations to federally qualified health centers. So all of the public health clinics in our county are FQHCs. They got an allocation from the federal government, as did the Veterans Administration. Add to that our area hospitals. The hospitals receive their allocation from the state. So nowhere in this mix is the county receiving direct allocations for vaccines, the county government, the county commission, and nor are we storing any of those vaccines. So right now it's a state and federal operation.
When you mention so many places and so many access points, and everything, I don't understand how so many people are having a problem getting a vaccine shot, or getting an appointment for if there are that many,
Vaccines though, that's the problem. There's a lot of places potentially, but there's not vaccines. So for instance, I mean, the hospitals say they haven't gotten anything since they got their initial allotment for their healthcare workers.
Yeah.
And that's huge because that could have been, that's what's happening in Miami-Dade and Broward County. That's who, I mean, as I understand it, is doing a lot of the vaccinations in those two counties.
With the hospital, Jackson Memorial and others?
And Broward and Memorial Health, yeah.
Yeah, okay. Boy, all right. But I don't think Palm Beach County was designated as one of those, if I recall anyway. So we didn't get that. And which is kind of interesting, given the fact that we do have a taxpayer-funded healthcare district, and that you would think would be a perfect outlet for that, just a guess anyway. And hold on a second here. Let me. I'm trying to get through these questions here so I can make sure folks get. Oh boy. Well, and I don't know if this is an issue, but Celia Lopez North Durf said no clinics that take Medicare have the vaccine, and I'm not sure that's. I don't know if anything was really based on the Medicare in terms of.
Nobody should be charging you for the vaccine. The vaccine is provided for free.
Right. Okay. So I don't know if that would be a issue.
I don't think this is specifically what she's saying,
Sure.
but when Commissioner McKinlay was talking about the federally qualified health clinics, which the healthcare district is one of those, but a lot of the other ones, like Found Care, I spoke with them. They had not received any extra. I mean, they'd received like 200. And so a lot of their clients are not able to get the vaccine.
Okay. And I think what she was also speaking to, Commissioner, was when you were saying about the federal, the clinics here that are like they have some federal designation. I think you mentioned.
Right.
Okay. And that's, so the question is, do those clinics, they're also having an issue in terms of getting vaccine to distribute. Is that correct?
Yes.
Okay.
Yes.
All right. And so she was saying that her parents the clinic that they go to did not have any vaccine and or they aren't qualified or something like that. So.
Well, she could have been talking about the federal qualified healthcare clinics, or
right.
I think there is some feeling among doctors that that would have been a way to distribute vaccines as well.
Yes.
And doctors' offices have not gotten them either.
Oh, right. Private doctors' offices aren't getting them. That's right. Okay. And let me try to. We're hit our little time limit here, so let me try to ask a question going away right now. So I'm going to ask you both this. When somebody comes up and says, "What's the best thing for me to do right now?" Okay, given the situation, I'm 65 and over. I'm 65 and or 70, and I want to get the vaccine. What's the best thing for me to do right now? Commissioner, you want to take that first? What advice would you give, or what would you tell your constituent who asked that?
There are 4 million people in the state of Florida that are 65 and older. 400,000 of them reside in Palm Beach County. For the first few weeks, we were getting 4,000 vaccines a week. If you run the numbers, there's no possible way to have vaccinated everybody in such a short period of time.
Right.
I want folks to know that I really understand their frustration. We're frustrated too, but we've got to be patient. You encourage your member of Congress to push on the administration to purchase more vaccines, to get these pharmaceutical companies pushing out as many vaccines as possible. The best thing we can do right now is to increase the supply, and that way we'll be able to get more people vaccinated.
All right. Thank you. Jane, same question to you.
I really hate to say this, but I would go to Hard Rock. If I was absolutely desperate and I had transportation or the ability to drive, I would call the Hard Rock and see if I could get an appointment. Everybody I've talked to, pretty much. I'm not saying that I haven't heard people that have gotten them at Publix. I have. Obviously a lot of people have gotten them at Publix, and obviously a lot of people have gotten them from the county and the healthcare district. But I would encourage people to at least try that option if they don't want to get up at 6 a.m. on Wednesday mornings to try and win the Publix lottery. It's frustrating. I mean, I feel really bad for these people.
Yeah. And
let me add to that the Hard Rock site is a state-operated site. Your county commission is ready to roll out a big site like that at the South Florida Fairgrounds. The tents were actually starting to go up last week before the Publix announcement. We are ready to do a large-scale vaccination site like that. We just need the vaccines.
All right, that's good. That's good to hear. And so let me. So thanks to both of you for being here. But let me say also too that the only thing I would add is that if you're still waiting, and I hope you don't have to wait too much longer, but if you are still waiting, that to mask up. That just because a vaccine is available and some people are getting it, I don't think that people need to relax on the county's policy of requiring people to wear masks in public places when you go to restaurants and places like that, wherever there are gatherings. That you need to be careful. That honestly, even if you have gotten the vaccination shot, you should still wear a mask according to the CDC. So that is still, quite honestly, the best way until everyone is vaccinated to make sure that the virus doesn't spread, doesn't spread any more than it already, much more than it already has. Anyway, the best control we have right now is for you to wear a mask. So I would encourage everyone to continue to do that. And kudos again to our county for being one of those that really pushes that and refuse to back down on it as well. So anyway, again, my name is Rick Christie, and thanks for being with us today to talk about this very important issue of COVID vaccine distribution. I hope we were able to answer a number of your questions. I know we weren't able to answer all of them to your satisfaction, that this is a frustrating situation and everything, but as both of our guests made clear time and again, that the biggest issue that we are facing in terms of getting those shots into people's arms is getting more supply from the federal government. And so the Palm Beach Post will continue to report this, and I'm sure Commissioner McKinlay and her colleagues will also still be trying to figure out a way to get this done in a better way as well. So again, Commissioner Melissa McKinlay, Representative District 6, and also President of the Florida Association of Counties, thanks for sitting in with us this afternoon and answering some questions. And Jane, thanks first of all for all the great reporting that you continue to do. I know it's wearing you down, but bring it in there for us, all right?
All righty.
All right, folks, thank you for being with us, and we'll try to do this again very soon.
Thanks a lot.